Hello, bienvenue, willkommen, karibu, welcome to the MedLounge with Kristina, where we discuss everything medicine, health, and life. Hello, welcome back to the MedLounge. This is the MedLounge. I am Kristina, a medical practitioner based in Uganda. We are still continuing with our series on malaria. Last week I shared about the success story of the US in its eradication of malaria. We shall continue with that this week. I decided to cut last week's video a bit short, reason being it seemed to have had a lot of content or information, and if it's too much, it's a little bit hard for you to digest. So we shall be continuing with that in today's episode. We shall be looking at the other 9 countries that have been successful in the eradication of malaria. I will be sharing the years that they were able to achieve this. We shall not go into details of their success stories. You can always look this up if you are interested. I will share links to some of the websites where you can get this information. I will also share the factors that enabled the US to eradicate malaria. And finally, we shall look at why Africa is still failing, is still struggling to eradicate malaria. Don't forget to like, share, and subscribe if this is the kind of content that you are interested in, and if you love to learn more about health. 4 major factors helped malaria eradication in the US. Number 1 was strong government commitment. The federal and state agencies worked together in a well-funded, coordinated effort. Factor number 2 was advanced mosquito control. By the use of DDT and other vector control methods effectively, they were able to reduce mosquito populations. The US also had economic and social changes. They had what they called, or what you can call, the post-war urbanization, and that reduced exposure to mosquitoes. There was also improved housing. They were able to have air-conditioned homes, screened windows, which decreased mosquito entry into the homes. There was better healthcare access, which ensured rapid diagnosis and treatment. Factor number 4 was the winter climate. Now, the advantage of the winter climate is that, unlike in the tropical countries, colder winters in many parts of the United States naturally reduced the mosquito populations, which made the eradication of malaria a little bit easier for the US. After the United States, Japan was next in the success of elimination of malaria 10 years later. That was in 1961. Then we had Spain in 1964. Then there was Italy in 1970. Next we had Mauritius in 1973, and then Greece in 1974. Then we have more recent countries, those that were able to eliminate or eradicate malaria in the 2000s. We have South Korea, that was declared malaria-free in 2014, Sri Lanka in 2016, Argentina in 2019, and the most recent country that was declared malaria-free by the World Health Organization is China in 2021. So we now ask ourselves, if these countries have been successful, why is Africa still struggling? Why is it still a challenge for Africa to fully eliminate malaria? Africa still struggles with malaria. In 2022, Africa accounted for 95% of global malaria cases and 96% of malaria deaths. So the question is, why has malaria elimination been more difficult in Africa? Factor number one is the tropical climate. Now, our tropical climate favors mosquito breeding. Most of Africa, like we know, lies in the tropics. Here we have high temperatures, humidity, and abundant rainfall, and these are ideal conditions for the Anopheles mosquitoes to thrive year-round. So unlike Europe and North America, we lack the cold winters that naturally reduce mosquito populations. Factor number two is the high biodiversity of the malaria-carrying mosquitoes. In Africa, we have the most effective malaria vectors, which is the Anopheles gambiae, and this is highly adaptable. It breeds quickly and it bites humans more often or more frequently than any other mosquito species. And to make matters worse, some of the African mosquito species have developed resistance to insecticides, which makes the traditional control measures less effective. Factor number three is the limited access to health care. Many of our countries are underfunded and we have overstretched healthcare systems, which leads to delayed diagnosis and treatment when someone gets malaria. We also have rural communities that lack clinics, doctors, and essential medications, which makes malaria go untreated for far too long. Then we have the inconsistent drug and bed net distribution. Yes, we've had some malaria programs that distribute insecticide-treated bed nets and anti-malarials, but the coverage remains inconsistent because of logistical challenges, corruption, and funding shortage. And to make matters worse, we end up having stockouts of malaria drugs, especially in the rural health centers, which prevents effective treatment. Then we have poverty. Poverty and poor living conditions. Many people in Africa are still living in houses without screened windows. Some live in houses without doors. So many of us do not have air conditioning, which makes us more vulnerable to mosquito bites. Factor number six is the political instability and conflicts. We have countries experiencing civil wars and political instabilities. We have countries with refugee crises, countries like Sudan, countries like the DRC, countries like South Sudan. These struggle to implement consistent malaria control programs. We saw how the World War II affected the US in the fight against malaria. So these wars still affect Africa. The political instabilities affect Africa the same way that we had the Civil War affecting America. Then, of course, because of the wars, we end up with health services breaking down during these conflicts, which allows malaria to spread unchecked. Factor number seven is the low public awareness and cultural barriers. We have areas that still have misconceptions about malaria. We have people that may blame malaria on witchcraft, some believing that it can't be prevented, which hinders the prevention efforts. We also have communities that refuse to use the bed nets because of cultural reasons, and some repurpose these bed nets. I've seen bed nets being used as uh, fishing nets. I've also seen bed nets used in uh, coffee nursery beds. So the misuse or repurposing of the bed nets reduces their effectiveness. The nets are given for people to use, and they find other uses for them. The other factor is the inconsistent and ineffective vector control. Countries like Italy and China used large-scale swamp drainage to get rid of mosquitoes, which is impractical in Africa. Reason being, we have extensive wetlands and most of our rural communities rely on these water bodies as their main water source. Also, DDT and some of the other insecticides that the other countries used previously have faced mosquito resistance and environmental concerns, so limiting their long-term effectiveness. So there is also rapid urbanization, but with poor sanitation. Many African cities are growing rapidly, but they lack proper drainage, and this leads to breeding grounds for the mosquitoes. We've witnessed this. I can give Kampala as an example. Every time it rains, we have flooding, and all this is because of poor drainage systems. Then we also have drug and insecticide resistance. In the past, we were using chloroquine and fancida in the management of malaria. Those drugs are no longer in use because of resistance. And recently, artemisinin resistance is also emerging. So drugs like Cotam, Lonat, in some countries in Africa, we are already starting to witness resistance to this. So that will affect the treatment of malaria. So our mosquitoes have also developed resistance to insecticides. So both those that we use for spraying and those that are used for in the bed nets. And this means that with time, bed net use and indoor spraying will be less effective. And there is dependence on foreign aid and donor fatigue. The malaria control in Africa is heavily dependent on international donors. Most of the key donors that we have include the Global Fund, the Bill and Miranda Gates Foundation, we have the World Health Organization, we have the US President's Malaria Initiative, and like we've noticed, funding is not always stable, and that leads to gaps in prevention and treatment efforts. We've seen the US recently pulling out. We had the USAID being pulled, and President Donald Trump pulling out funding. And these are likely to affect programs like the malaria control or eradication programs. Then there is short-term projects versus long-term commitment. Most of the malaria programs are short-term. They are running for periods of like 3 to 5 years instead of being sustained long-term government investments. We've seen countries that eliminated malaria like China and the US had continuous funding for decades, while here in Africa, malaria funding fluctuates. So that in turn affects elimination programs. So the big question is, what needs to change? What do we need to do? What needs to change for malaria elimination in Africa? First of all, we need to strengthen our healthcare systems. We have to ensure widespread access to malaria testing and treatment, especially in our villages, in the rural areas. We need to train more healthcare workers on how to diagnose and treat malaria effectively. There is need to invest in mosquito control. We shall have to develop insecticides that work against resistant mosquitoes. Then There is the use of genetic engineering, that is gene drive technology to control mosquito populations. The world is constantly developing. We have new technologies always coming up. Gene drive technology is one of the methods that could be effective against mosquito population control. Also, improving urban sanitation and drainage will help in vector control. There is need to increase local funding and political will. We can't constantly rely on donor funds. We need to reduce our dependence on foreign aid. And we need to integrate malaria elimination into the national development plans, like China and Italy did. There is also need to improve public education and community engagement. We shall have to launch massive education campaigns, work with rural leaders, local leaders, religious groups to change malaria-related cultural misconceptions. And finally, the thing that is showing the most promise is the malaria vaccine. We have the vaccine, they are promising. It will help a lot. I'll be sharing more about the vaccine, the misconceptions about the vaccine, how effective the vaccine is, what we need to worry about. We shall talk about all the controversies that have been there, what makes the R21 vaccine different from the RTSS. We shall discuss all this in the next episode that I will be doing. For now, I'd like to thank you, all those that have been here. Please like, subscribe, and share this video with those that you feel may benefit from it or may be interested in it. And until next time, kwaheri, au revoir, tschüss, bye bye.